Happy Saturday to all of you. I am live on Instagram and YouTube. Welcome to Dr. J's Prescription for Health. In case many of you or some of you who do not know me, I am a family practice physician. My name is Dr. Malea Jensen. I'm located in Iowa. So good morning, everybody. I've been in practice for a little over 27 years. Again, I'm family practice board certified, and I have recently, well, not recently, I guess it's been a few months. It's been 6 months. I closed my, are you not on YouTube? I am on YouTube. Yes, I am on YouTube. I should be live right now. I am live right now. It says I'm live, Lucy, so can you check? Go and check and see if I'm there. So the past, good morning, Melanie. The past 6 months, I have been building up clientele through a consultation services where I review your labs, I review your medications, I review your medical diagnoses, I review your exercise and your diet regimen. These are the things that I do during consultations. It is not a substitute for your doctor, your primary care physician, or your specialist. Good morning, Linda. Thank you for being here. Okay, see, Lucy's, okay, good deal. Okay, Lucy is, how come we don't have a blue wrench on you, Lucy? Are you gonna stay on YouTube? We have moderators on YouTube. They are the blue wrenchers. They help with the moderation over there, so. Let me know if I need to make any changes, Lucy. Let me just see if I can do that here. There we go. So if Lucy accepts that, then she can become a blue wrencher over there on YouTube. So I appreciate their help over there. You Facebookers are pretty calm over, or excuse me, on Instagram, you're pretty calm. So I appreciate that. Thank you, Linda. I appreciate that. Okay, so we'll get started. This is your opportunity to ask questions, medical questions. So ask away. I will do the best I can and try to answer them. But again, this is not medical advice. It's for information purposes only. My hopes that you will be educating yourself and ability to use the information that I am providing. Look it up. Check me on it. Check me with AI, whatever it takes. But you need to start getting in the habit of saying, okay, there's a dichotomy going on. There's, where you stand to, I guess, where your experiences lay or lie. How have what you've been taught over the years fortified your thinking? Okay. Vadir, where are you from? Oh, Vadir. Yeah, I am from Iowa. Where are you from? Okay. I'm trying to keep up with the questions, make sure that we don't have any. Okay, here's one. Is fasting appropriate? Appropriate, what's the definition of appropriate? That's kind of an open, I love how you guys ask questions, but I think if we get more specific on what the question is, because I think it would be less of me talking and more of you guys being able to ask questions. So is fasting appropriate? It depends. It depends on who you are, what your body type is. Where I feel that fasting it might not be a good idea. There's actually two examples where I would give where I don't think that fasting might be appropriate. Number one is if you are insulin resistant already, you have very high insulin levels, okay? This is probably not a great opportunity for you to be fasting. And the reason I say that is because it will be very difficult for you to withstand your hunger. When insulin is high, it has a tendency to drop your blood sugars. This will make you hungry. So if you don't eat and you over-exercise, you will go to the party very, very hungry. And so why would you put yourself through this torture? It would be a better idea to allow your insulin levels to come down, and then you could possibly start fasting. There's an instance where I don't think, even when your insulin levels are down, I don't think it's appropriate to fast. So does everybody understand that? With high insulin levels, so you've been eating the standard American diet, you're insulin resistant, you might even be diabetic, your insulin levels are high, this is not the time to stop or fast, stop eating and fast or over-exercise, because you're only going to make yourself hungry, and it's just not a good scene. When you're hungry, you will eat all of your addictions. So the best thing to do is first to get your insulin levels down, and that is through low carb or no carb dieting. So you're still eating, you're eating whatever, you're eating as much as you would like that does not have carbs. Your insulin drops, now you can incorporate fasting. The other time where I do not think fasting is good for us is when we do not have much body fat. If you do not have much body fat, when we fast, the purpose is to use fat breakdown as an energy source. If you are not taking in anything like ketones, like amino acids, like fat, in order to break that down and use it for energy, guess what you will use? If you have it, you'll use your muscle. Anytime that we run out of fat on our body and we are not eating, consuming anything coming in, so fasting, that is called starvation. I know you guys use that word all the time. What is starvation? Great question, but you say the word so nonchalantly. Oh, I'm starving, as if you haven't eaten for days when you just ate about 4 hours ago. That is not starving. The true definition of starvation is when you don't have any more body fat to use as an energy source to make ketones. Nothing is coming in, you're not eating. You're gonna start breaking down muscle. And that is not a good thing. Sarcopenia. Losing muscle is not a good thing. So fasting in this state, when you don't have a lot of body fat, is not in your best interest. If you want to preserve muscle. Now, if you just want to be a skin and bone person, then by all means, that is a great way to do it. Okay? You will be starving. You'll go into starvation mode, which is basically eating yourself, eating your muscle. You cannot get into a starvation mode if you have body fat. So the person I do not believe should be fasting is a person with no body fat, because you're only doing yourself a disservice. I don't think that you should start fasting if you have high insulin. Even though you have a lot of body fat, you will not start burning that fat until the insulin levels come down. You cannot burn your own body fat until insulin levels are in the 3 to 5 range. Hopefully that is making sense. Lucy, okay, she did, okay, good. She did accept the blue wrench. So if you see somebody with the blue wrench, they are my helpers, and I appreciate their help. For those of you who are on YouTube, put a question mark in front of your question. If there are lots of questions, I will answer the super chats and or super stickers first. They come first. You should be able to see what I believe in the comment section is a $sign or something like that. And you can put in your, you can put in a super chat, or must have missed a bunch of questions. Let's see. Linda asks, what is your dental care, toothpaste, mouthwash? My dental care, twice a day, I'm using a hydroxyapatite type of toothpaste. I don't use mouthwash. I will use warm salt water as a wash. Good morning, Connie. Okay, so our moderators, if there are derogatory comments, we will be deleting those. There's just no room for stuff like that. I won't tolerate that. What do you recommend with meat and eggs? Butter. Butter goes awesome with meat and eggs. Bacon goes with meat and eggs. Those are the things. I do fish meat and eggs. I do chicken meat and eggs. Those are the things. It's not that I recommend it. You can do whatever you would like, Rob, but what I do is what makes me successful on a lifestyle change. Luke says, I work in heavy construction. I only eat one meal a day, around 7 to 8% body fat. The only sugar intake I get is from fruit. Okay, so are you eating that at your meal, or are you eating snacks in between? I'm 45 and been the same weight from 16. Well, how's your body fat, Luke? Are you just worried about your weight, or are you worried about your body composition? I would worry less about my weight, especially if you're muscle and no fat, but if your weight is the same at 45 as it was at 16, I can't really suggest to you that is in your best interest. But, as an adult, our muscles should be growing, our bones are stronger and heavier, and it sounds like that you might be in a state of atrophy. But again, if you would like to consider a consultation, I appreciate people making comments, but what I would suggest to you, because I'm going to stop reading just comments. If you have a question, either do a super chat if you truly want that, to help the channel, but simply putting a comment in from here on out, if you want to state it in such a way that, this is how Luke could have presented this in question format. I work in heavy construction. I have 7 to 8% body fat. Is this healthy at 45? My weight is the same. So you could pose it as a form of question, but if you're just going to make a comment for everybody to read, it's basically just taking up space. Rob, I think I answered your question. What if you're just eating meat and eggs? What can go with it? More meat, more butter, more bacon. That's what you can eat with it. Okay. Thank you, Linda. I appreciate that. I'm skipping over just comments. I'm looking for questions. Okay. Kelly says, when reducing carbs and increasing protein, how do you fix constipation that can happen when making the change? More fat. If you are just going to lower carbs and you're going to increase protein, I would suggest to you that you need to be looking at your fat content. And I also need to know, Kelly, what is your definition of constipation? Because constipation does not necessarily mean frequency or lack thereof. So if you consider constipation not having a bowel movement for 3 days, that is not necessarily constipation unless you're having symptoms. If you're having symptoms of belching and bloating and cramping and abdominal pain, then I could see where you are having maybe some symptoms of constipation. But frequency of bowel movement without symptoms is not constipation, okay? So what helps with stools? Yes, you could increase your fat content. You want, I believe, my thought process, you need at least a 1-to-1 ratio. And most animals that you consume in their natural sources are a 1-to-1 ratio. Now, if we go buy 97% lean ground beef, that is not that is not a 1-to-1 ratio. Okay, you're likely going to need to add fat. Hopefully that answered your question. Melanie asks, not a math major, but when I did the math on statistics regarding statins, cholesterol medicine, and prevention of certain disease processes, most of them came to about less than 1%. Is this about right? Melanie, I'm not exactly sure what the question is. What you're asking on the statins and the prevention of certain diseases. So statins are used as a way to decrease cholesterol. And in so doing, when you lower cholesterol, you are lowering your risks of cardiovascular disease. Okay? And when you're looking at the statistics, we need to take into consideration relative risk reduction of cardiovascular disease with statins, or absolute risk reduction with the use of statins. That is important, because if you are watching commercials or you're listening to your doctor, they could say that if you take such and such statin at this dose, you're going to have a 30% reduction in a heart attack or stroke. Well, that is not necessarily true. You want to ask the doctor, could you put that in absolute risk reduction form? That is where they are missing the boat and not teaching you the difference between relative risk reduction and the absolute risk reduction. Okay? Okay. All right. Arizona Nana says, what is important when buying meat? Grass-fed, antibiotic-free, a local butcher, all of the above. So if you can afford it, this is something that you're on your journey. I would consider buying grass-fed organic meat. They're not going to be using antibiotics. They're going to not be spraying their fields where the grass is being fed to the animals with glyphosate. But that doesn't mean that the glyphosate is not in the air. It can be in the air, all right? And it's still going to get on the grass that the cow is feeding on. You can't put an umbrella over your land. Is the local butcher the best way to go? Well, it depends on where the local butcher gets his meat. If the local butcher is getting it from the exact same place that the grocery store is getting it and they call themselves local, if the local butcher is getting it from the farm down the street and they're grain feeding, really, what is the difference? Okay. So I think you should probably look for grass-fed organic if you can afford it. Oh, Melanie is adding to her question. You relayed that you would have to treat about 400 people to save one person from having a stroke. When you do, and you got to do that for 5 years. So you would have to take a statin for 5 years in order to, that was where the statistics that I was using came from. And I would agree with you. Those statistics show a less than 1% absolute risk reduction in preventing. So you have to my thought process is we have to weigh the pros and the cons. If we are not weighing the pros and the cons, and are you willing to accept side effects from a statin in hopes that you need to be one of 400 people taking one of 400 or one of 265 in order to prevent a heart attack. You have to be one of those taking it for 5 years and then accept that you could get side effects. You could get diabetes. You could get Alzheimer's. You could have muscle aches and pains. You could be low on vitamin D. You could be low on CoQ10. All those things. You're willing to accept the consequences of taking said medication, that all medications, just so you know, will block a normal biologic process in your body. So I think it is prudent to look up what that medication is doing to the process that you're trying to block or to augment, like in the case of a GLP-1. What they all have side effects was they're all changing a normal biologic process in our body. These are normal things. By taking a medication, I'm just saying, I'm not saying all medications are bad, but they're changing a normal biologic process in your body. So you're basically giving the finger to God. So you want to do something that has a consequence, yet you're not willing to maybe accept that consequence for the benefit that it might provide. And we do this all day long. Let me give you just a very, what I would call a very simplistic analogy is when you get in your car, you have to weigh the pros and the cons. You see a train coming and you weigh the pros and the cons. Do I have enough time to make it across the railroad track before the railroad track doesn't hit me? So you weigh this in your head. You make judgments all day long. And I know that sounds like, well, that's pretty obvious, but the same thing comes, you're just, if you ask me, what are the pros and the cons of taking a statin? Immediately it comes fast, just like I would have to weigh the pros and the cons of crossing tracks when a train is coming. That's how easy it is. You guys are maybe at a point where, gosh, I really don't know. Should I or shouldn't I not? That means that you don't have enough information coming in to make an informed decision. You're not familiar with the topic enough, statins, and the biologic processes that going on in your body. But I know it is difficult. I'm still learning it. After 27 years, I'm still on a journey of learning biologic processes and physiologic processes in my body, in your body. I am not completely aware that those are all the things that are going on. It's a learning process, and then we look into it and we make judgments, or we make good decisions based on the appropriate amount of information. So you guys not knowing about statins, I could see where it would be confusing. But you have to take the bull by the horn and start learning yourself instead of me spoon feeding you. Tyler, thank you for the gift. I really appreciate that. You're very kind. It looks like a bunch of flowers. I don't know exactly what that is. This is new to me, you guys. Thank you, Lucy. I appreciate it. Okay. All right. It might be something that we need to, there we go. All right. You guys, I'm not seeing questions. Oh, here's a question from Kelly. Again, Kelly is doing appropriate. You others are maybe just putting some statements in here, and I'm not going to waste everybody's time by reading the statements out loud, but Kelly has a question. When switching from a standard diet to a carnivore type diet, how long should the transition be? Well, if you switch, are you saying should you just go cold turkey? Or should you just try to lower your carbs gradually over time? I think it's up to you how you want to do it. If I was telling an alcoholic, should I just try to just cut back a little bit gradually over the next 4 months? or should I go cold turkey? If you give a little bit of alcohol to somebody who is an addict, you will never be able to attain your goals. So if Kelly is addicted to carbohydrates because she loves the dopamine hit that it provides for her brain, if you tell her, oh, just try to cut down, like go from 100 grams to 75. But Kelly's is used to 100, so she's going to be craving carbs because you gave her a little taste of it. So when I did it, I went cold turkey because I don't want to mess with. I want to go through a withdrawal process instead of over and over withdrawal every single day and having to use my willpower every single day that, oh, I'm going to do 100 grams today and 25 and 75 and then 70 and 50 and 40 and 30. No, I don't want that torture. That could take me a month. I do not want that torture. I want 3 days, get it out of my system and be done with it. Diaminoxidase says, I can't avoid sugar, totally depending on it. No, you're not dependent on it. That's absolutely not. You're addicted to it. Change your wording and look into it. Why am I addicted to sugar? Look it up. What do? Look it up. You need to stop. It is killing you, just like alcohol, and it is killing a person with alcohol that is an alcoholic. They're addicted to alcohol. Yeah, Lucy, thank you for that. If you guys want asking a question, put it in front of your question instead of after. I am from Iowa. Thank you, Linda. You know what? Linda, here we go. Linda is here almost every weekend. Okay. Just be cautious on who we are removing from I'm going to go to the very end. So if you had a question, I'm going to go to the very end on YouTube because there are a lot of just comments in there. Nancy, that is a question that I will need to look into more. I'm not sure that we need to be looking at as complicated as looking at IGF-1 as much as we should be looking at insulin. Lucy says, I just want to message you here since my IG friends are polite. I'm putting some people on timeout. Okay, sounds good. Thank you. Hello, Jana. All right. Yeah, I did, Lucy, so she just has to accept it. If you don't have a medical or a health question, please do not put comments into the moderators will put you in timeout. So that's what we need to be doing more of here. Did I miss any questions over here? We'll get this. I know this is a lot of pause and go and stop and go and stop. And I apologize, but we're trying to figure out this. The Instagram, it's not, I don't have a whole lot of problems with, but what is happening over on YouTube is I'm needing to have a lot of moderators. And once we get that, we get the gist of how the platform is going to run, it will be a lot better. So over there in YouTube, we got a couple moderators that are doing their best to set the standards. Okay. Here's a question that I think is pertinent, and it is asking in general, what is diabetes? There are multiple forms of diabetes. If you are a type 1 diabetic, you have low or no insulin at this point. In fact, if you are completely a type 1, it's not an in-betweener, you've pretty much, the wheels are off the bus and you're a type 1 diabetic, your alpha cells in your pancreas, in the endocrine portion, we have an endocrine portion of our pancreas and an exocrine portion of our pancreas. And in the endocrine portion, we have alpha cells and we have beta cells. All right? The alpha cells produce glucagon and the beta cells produce insulin. If you are a type 1 diabetic, you have antibodies to your pancreas. And your beta cells no longer produce insulin. All right? They no longer produce insulin. And so in order for a type 1 diabetic to survive, they need to take insulin. Does this give them a free license to eat carbohydrates? Just depends. Then they're just like anybody else. Their shot is their pancreas. So if they choose to eat a bunch of carbohydrates, they're going to need more and more insulin to take care of that blood sugar, or they will get hyperglycemic and perhaps even go into ketoacidosis. So a type 1 and a type 2, as far as diet is concerned, it's equally important, because what you eat, diet matters. What you consume is going to tell you how much insulin I need to inject, or how much insulin my personal pancreatic beta cells need to produce. The more carbs you eat, the more insulin is needed. Can a type 1 diabetic have very high insulin levels that lead to cardiovascular disease? Absolutely. So a person who told me the other day, as long as you give insulin to the type 1 diabetic, they can eat as many carbs as they want. The answer is absolutely they can. But is that going to help their disease? Is that going to help them prevent cardiovascular disease or dementias, which is likely a cardiovascular disease? No. Ketoacidosis is very, very high blood sugars, and the body is going into extreme ketosis. This is not the same as you going on a ketosis diet where you are, let me get this straight. Okay. When you go on a ketogenic diet, you are lowering your carbohydrates in order to use fat as a source of energy. And your body is able to program that and know how much fat to break down at any one time. So a person on a ketogenic diet doesn't go into ketoacidosis. But if a person who's type 1 diabetic does not take insulin, okay, that means the blood sugars are going to go sky high, okay? It needs insulin. Your body needs insulin to get that sugar at least into cells. So they're going to be breaking down fat wildly. That's why a type 1 diabetic continues to lose weight no matter how many calories or how much food they eat. They could eat 10,000 calories and never gain a pound because they don't have insulin on board to drive that sugar into cells. The minute you give insulin, the cells goes, whew, I was starving. The cell itself is starving. So that person can go into ketoacidosis. And yeah, if you don't bring them out of it, if you don't give them insulin, they could die. Here's a question. Can you recommend quality medications for high blood pressure? Why I think you should lower your blood pressure naturally by lowering your carbohydrates. If you lower your carbohydrates, you will lower your insulin. Insulin has a habit of causing salt and water retention. So if you lower insulin, you will dump water and sodium, and your blood pressure will naturally come down. Also, for people on YouTube, if you are continuing to answer medical questions, again, this is not medical advice. You should not be, if you have a question on berberine, oregano oil, or anything like that, you can ask. However, by soliciting your advice is likely going to influence people, and they will consider that medical advice. So please refrain from doing that, or my moderators will take care of that. Okay. Okay. Linda asks, are there any, is GBS, is that Guillain-Barré syndrome? Is that what you're talking about? Please let me know. This is a good question. What about glucose spikes being the main cause of aging? I would wholeheartedly agree with this. But here's what many of the high carb people or pushers of carbohydrates, I'm not sure that they understand. Maybe they do. But anytime you eat sugar, even if you have a ton of muscle, let's just say you're a bodybuilder and you're eating the 10,000 calories, okay? Or 5,000 calories. And much of that is in carbohydrates. You will raise blood sugar. Those spikes require insulin to do something with that energy coming in. There is a lot of it. What is happening is anytime you consume carbohydrates, anytime you consume sugar, you will get glycation. Glycation, anytime sugar is on board, glycation is sugar binding to a protein. Okay, that's what glycation is. Sugar plus protein. The sugar gums up the protein no matter where it is. So from an aging standpoint, most of us think about wrinkles. So if we have a sugar always on board, or you have binges of sugar, that spike of glucose will cause glycation, high amounts of glycation. In fact, fructose glycates faster, 7 to 10 times faster than glucose. So if you want a for sure way to age yourself, eat fructose, eat fruit, eat high fructose corn syrup. That will age you faster. I mean, I'm not going to even, I could have given you an analogy. There is a influencer on social media that promotes eating high amounts of sugar, of fructose, fruit. Yet over the time period, maybe over the last year, I have noticed that this person is aging faster than I would have imagined. I mean, this is a young person. I think young person, I don't know the age, yet they look 10 years older to me. I don't follow them all the time, but I go, is that the same person? And then I look back, I'll go back and say, oh my gosh, they've really aged over the last year. Now, could that be glycation? I think yes. So glycation, you guys, when a sugar binds to a protein. So in our skin, we have proteins, collagen, elastin. So when sugar binds to collagen and elastin, the result is wrinkles, aging of the skin. When it binds to proteins in our eyes, we get glaucoma and cataracts. When it binds to red blood cell hemoglobin, Hemoglobin is a protein. So if sugar binds to hemoglobin, we can measure hemoglobin A1C. When glucose binds to hemoglobin, we can measure hemoglobin A1C. Hemoglobin A1C does not measure fructose glycation. You have to run a totally different test. You can run glycated albumin, you can get a fructosamine. There are other ways, but if you feel that you don't have diabetes, okay, and you're eating a ton of, because your A1C is okay, which brings me to another question that I have for you guys. If you are eating a lot of fruit and you note that your A1C is okay or it's below 6, so you're not diabetic, you're only fooling yourself because that A1C is not measuring your fructose, okay? UNG says, my blood sugar is normal, but my insulin is too high. Help everybody out. What is too high? It would be best to give numbers because you said your blood sugar is normal. I don't know what normal is. I mean, I know what normal is. A normal would be a 70 to 80, but your insulin is too high, so that means it's over 3 to 5. What should you do in this case? You should get your carbohydrates down. The carbohydrates are raising your insulin, okay? So your blood sugar, people are glucose centric all the time. They're measuring their blood glucose levels and they go, oh, it's normal. I don't have diabetes, because they're insulin resistant. Their pancreas is pumping out a bunch of insulin to try to keep that blood sugar in what you consider a normal range, which I consider 70 to 80. Let's just say 80. A normal blood sugar in a fasting state is 80. And it should be that. So if you have an 80 blood sugar, but your insulin is 15, you are not healthy. You are metabolically in a world of hurt, okay? Yes, AGEs, Colin, advanced glycation end products, AGEs. So when A, glucose, with B, protein, makes C an AGE, advanced glycation end product, okay? What are the healthiest proteins to eat? Anything that comes from an animal. And vegetables that are lowest in carbohydrates. You can look that up. I do not eat any plants. There is no nutritional value to plants. Absolutely none. There's no essential carbohydrates. What are my thoughts on vegetarian diets? You can eat a vegetarian diet if you want. Do I want to eat a vegetarian diet? No. That is my thoughts on it. Denver asked, does it matter if it's simple carbs or complex carbs? No, it does not. It's just timing. So if you think that simply eating a complex carb, a carb is a carb, it's sugar. Whether it releases slow or releases fast, you're still getting glycation. Sugar is sugar. What about skin photo degradation? Explain. Maple, if you want to have a consultation, you can email me at IronLadyDoc@AOL.com. AOL.com. IRON, IronLadyDoc. Okay. Bab says, you're a carnivore. Actually, I'm not a carnivore. To me, by definition, a carnivore is somebody who eats zero carbohydrates. And I do eat some carbohydrates. The carbohydrates I eat do come from an animal in the form of cheese, but that is my carbo. So I cannot tell you that I am a carnivore. Again, Maple, I appreciate you're giving your symptoms. However, It sounds like that you would be best seeing your primary care doctor or scheduling a consultation. Is protein powder healthy? It's processed. If you are okay with eating processed or consuming processed stuff that comes in a box, bag, jar, container with a barcode, then go for it. But you're basically eating a bunch of processed, well, it comes from a beef. Well, it's still processed. Why not just eat the steak? Why would you choose to eat a protein powder that is full of denatured amino acids? Because that had to go through a processing. You know, you got to concentrate, you get the whey, isolate. There's so many things, but you know, it's it is what it is. It's processed and it's denatured amino acids. And denatured amino acids will spike your blood sugar faster or as fast as if you take a spoonful of sugar. They cause a lot of insulin resistance in people. What's your thoughts on celery blend and celery juicing? I don't eat plants. So my thoughts on you're causing a lot of nitrates to be produced. Okay. Okay, Colin, I do agree with you on that, but it wasn't in a form of a question, so I'm going to skip over it. It's understandable, TL, when you're trying to get in enough protein powder or protein in general, like if you weigh 180 pounds of ideal body weight and you're trying to get 180 grams of protein, consuming whole animal products is in your best interest. If simply adding a protein powder to get in amounts of protein that you think are needed, I would not do that. You're only adding problems to the situation. You're increasing your risk of becoming insulin resistant. Dirty Muffler says, do you have any thoughts or insights about high dose liposomal melatonin supplementation? I don't. Linda says, yes, Guillain-Barré, but now I don't know what your question is. Babs says carnivore is like 10 grams of carbs. It's actually 0. Ketovore could be under 10 grams. Keto is keto is 20 or less. Ketovore, 10 or less. Carnivore, 0. Maple says, is your email on your channel information? It is. What is my profession? I'm a family practice physician in Iowa, in the United States. No, I do not eat plants. Yes, I do. I drink coffee. Thank you, Lucy. IronLadyDoc at AOL.com. Thank you. Truth Seeker, I agree. TL says, do you think cooking with avocado oil is healthier? Is healthy? Healthier than what? Healthier than butter? No. Healthier than tallow? No. Healthier than lard? No. Healthier than canola oil? Yes. Healthier than any other seed oil? Yes. I don't know about any new treatments, Linda, for Guillain-Barré. Yes, Babs, I will call it Ketovore. Thank you. If you guys have a question, put a question mark in front of it. Otherwise, I will continue to just read past your things. Kelly says, how many meals do you recommend a day? For myself, I eat 1 to 2. I do not do much fasting. I do try to, I don't want to burn muscle mass. I go by body fat composition. Of course, I have body fat. And if I do fast, I will have enough body fat that would probably sustain me for a month. But I want to make sure that I am getting enough fat and protein in my meals that sustain my exercise routines, which is lifting weights. I want more muscle. It is difficult as we get older to build muscle. And yeah, I want it. And yeah, skipping meals is not in my best interest. I am not opposed to fasting if the alternative is to eat something full of crapola. So I will avoid crapola and fast. But how many meals I eat until I'm comfortably full at each meal. So I will eat, half a pound of ground beef and 4 or 5 eggs twice a day. I might, like the other night, I had chicken and eggs with the family. And sometimes I'll eat fish. I do eat sardines. I will eat some tuna. I will eat some salmon, but it's not a staple. The sardines are. I eat organ meats. I love liver sausage. It's my favorite form of liver. So we should be eating. Let's see. Linda asks, is vertigo part of a Guillain-Barré syndrome? Usually it starts peripherally if I'm not, or is it centrally? You know what? I haven't seen a Guillain-Barré since I was a resident, and that was a lot of years ago. It is very uncommon. Well, it's becoming a little more common recently in the last 5 years. So depending on what has been happening in the last 5 years, Guillain-Barré might be more prevalent. But I would go on an anti-inflammatory diet, meat, salt, and water, the ultimate elimination diet. How can a woman increase bone density or reverse osteoporosis? Fat, high protein, moderate amounts of protein, high fat, and a weight-bearing exercise routine, lifting weights. Thanks for the question, John, but next time, please put a question mark in front or do a super chat. You guys want your questions answered? Consider a super chat. It not only helps you, but it helps me grow the channel and make a living. Kelly says, how many grams of protein do you recommend to consume per meal? I think that if you're going to eat 2 meals a day, well, first of all, the amount of protein you need, I believe, if you are an exercising person, I think you should get 1 gram per pound of ideal body weight. So if your ideal body weight is 150 pounds, you should get 150 grams and maybe divide that into two times. So 75 and 75, okay? Good morning, Retail My Ride. Thank you for being here. I appreciate it. TL says, do you have any recommendations how to lubricate your frying pan so your eggs don't stick? Tallow, lard, butter. One of those, or all of them. Do you still hear stigmatized language such as substance abuse, even though it's been phased out of the current DSM? So the DSM-5 does not use that particular wording anymore. What wording do they use besides substance abuse? Do I find it stigmatizing? I think people have become numb to the words substance abuse. And many people, when you talk about substance abuse, they will think about alcohol only, or alcohol and drugs as their substance, their drug of choice. But in all reality, a drug of choice could be food, It could be sex. It could be shopaholic, over shopping. It could be, buying whatever. It could be over exercise. That could still be a substance abuse, is using exercise as your drug of choice. Do I use substance abuse terminology? I guess it depends on who I'm talking to, what their questions are, and how they relate, because they're using a term. And so sometimes I will say, what is your meaning of substance abuse? I like to ask questions with questions because I want to understand, what is your thinking process? What is going on in your thinking process? How do you define this? I think that's important for people. And so if you say, what is the best protein to eat? I would question, or how much protein. I would question, what is your goals, or what do you mean by, protein? Are we talking about protein powder? Are we talking about, I don't know. Asking a question with a question is I think, a way to stimulate conversation. Ungo says, my insulin is 19.2. I guess that's not normal. It is not normal at all. Between 3 and 5 is normal. A person like this with an insulin level of 19.2 will find it next to impossible to lose body fat. You will continuously be attaining body fat with an insulin level of 19.2. You cannot lose, you will not be able to lose or burn your body fat with an insulin level of 19.2. What do I use to season? Salt. Thank you. Babs, thank you. Thank you so much for the super sticker, super chat. Wish you were my doc. Do you watch Bart K? One, thank you for the compliment. I'm nobody's doc right now. I am a physician who is coaching. I love to coach people. I love to educate. I love to provide information. I want to stimulate you guys to start using your brain. Do I watch Bart K? Yes. The reason you might say, oh my gosh, you watch Bart K? Or you go, you watch Bart K? Here's the deal. I do watch people, even if some of the things I do not agree with, because they stimulate me to think. I'm going to go look up stuff. I listened to a doctor this morning when I was working out. I listened to him and I go, he said something, and I go, you basically just broad stroked something. Now, part of what he said was absolutely true. And I'm not going to, I don't want to say what it is. But then the other part, and then I have to find myself, go look that up. You know that what he just said, it shocked me. It's like a red flag. It was like my BS meter just went up. I have a BS meter. It is hypervigilant. And the BS meter went off the minute he said it. And I go, whoa. That is not true. Or part of that's true and part of it is not. I got to go look that up, because in my mind I said, that there's something he just said I don't think that's true. Okay? And I did look it up. Was he right? Part of it, yes. Was I right? Part of it, yes. Because I even said the answer to myself. So mostly I was right, because he left out something. But it makes people think that what they're doing is okay, and it's not. That's what I'm talking about, it's almost like omitting some really, really important things in order to gaslight somebody. I don't like gaslighting people. My gaslighting, you might think my sarcasm is gaslighting, but in all reality, my sarcasm is in hopes that you will use your brain and go prove me wrong or prove me right, whichever is the, whatever you look up, okay? And then bring it back to me. There was somebody on my Instagram feed who said something, kind of in so many words, told me I was wrong. And I came back and said something. And then they came back in a derogatory, sarcastic way, knowing, because that's gaslighting, knowing what things I would come back with. So it's gaslighting, set me up. Was I right? Yes. But they're going to twist that information. And you know how I ended the conversation? I said, you know what? Thanks for your input. And he came back and said, you know what? It was really nice having a conversation without being so, or, going back and forth and calling people names, which we didn't. It was a civil conversation. But they had their blinders on, and I've had those blinders on, and now I'm over here. Okay? The topic of choice was on, I believe it was on statins. Okay? And so if you have been indoctrinated, or you have, there isn't even cognitive dissonance, but really, if you have a thought process going on in your head and you know that this is the only way, and you cannot go outside of that, you are going to be stuck in your cognitive dissonance. You cannot get out. This person was actually willing to not let himself blow a gasket and say what he really wanted to say to me, because I know what these people want to say. But I've been there. I've been so indoctrinated that I want to tell you how dumb you are. Yet when a patient called me dumb, not in so many words, I fought back and wanted to look it up, because that's me. And then when I found out that they were right, I invited them back to my office and I said, I want to thank you. Well, for what? What do you want to thank me for? They were clueless. They were just trying to help me out. But to me, I was very appreciative. And so we spent a half an hour probably discussing the information they gave to me and the information I looked up. It was awesome. Now, I do not know. You guys might have to help me out here. I can't read anybody else's questions because the super chat stays on here. So Babs's super chat is staying on here. And let me see, do you swipe it? No, you don't swipe it. So I answered Bab's question. How do I get that question to disappear so I can read everybody else's questions? Lucy, are you still there? Because I'm having trouble. I cannot see anybody's questions. Because I have, okay. Did I miss anything? I'm going to go, I'm going to go to the end. Linda says, don't plants provide minerals or chlorophyll or fiber? They might, but they're also genetically modified, made in a lab. Oh, okay. Lucy, I got it. I think I went back, I tapped it, and we are good. I'm back to reading questions. I see it now. Thank you so much. I appreciate it. Bab says, okay. Thank you. I appreciate your subscribing. If you guys, that reminds me, if something I'm saying is helping you and you think it could help somebody else, please share this video with somebody so they can listen. We are a little bit, in the learning process here. It is not running as smoothly as I would like, but we're going to get it. Lynn says, what is your feeling on statins? Since you asked me an open-ended question like that, I'm going to answer you back with an open-ended answer. It depends. If you want a specific question in regards to statins, let me know. Bab says, we do not require fiber. I agree, we do not. Thanks, Lucy. You're like on top of it there. What do statins do? Ask Mike. Mike asks, what do statins do? Statins lower cholesterol. Statins lower LDL. Statins lower lipoproteins. If you take a statin, your total cholesterol will go down because total cholesterol is carried by lipoproteins and LDL carries cholesterol. So if you lower the amount of LDL in your body, you're going to naturally lower cholesterol. Does it only lower LDLs? No, it lowers some HDL as well. Does it lower triglycerides? I have not seen that to be the case, that statins can lower triglycerides. What else do statins do to our body? Because statins are HMG-CoA reductase inhibitors. I know, it's a big word, big words. That is their mechanism of action. They block the mevalonate pathway. They will, if you look up the mevalonate pathway, you will find that the end product is cholesterol. So an HMG blocks way upstream. In order to make cholesterol, you need an enzyme that breaks down HMG-CoA. So if you have HMG-CoA and you want everything else downstream, you need an enzyme, and it's called an ACE, A-S-E. All enzymes end in A-S-E. In this case, it's a reductase. So it's going to reduce HMG down to whatever the end product is. In this case, cholesterol, but there's some in-betweeners. So if you are taking an HMG-CoA reductase enzyme inhibitor, it's going to block the breakdown of HMG-CoA to get our end products. So you do not have this enzyme in order to break this down. So you're going to have a buildup of this and none of these things. One of those things is vitamin D. Another thing is cholesterol. Another thing is CoQ10. If you think that God messed up when he made a natural physiologic biologic process in our body to break down HMG to cholesterol, and you, man, is going to say, cholesterol is bad for us, we need to block it at all costs. Well, do you think God made a kill switch in us that says cholesterol over 200, death? No. So you're blocking a natural biologic process in our body. You say, oh, statins are good because it lowers our cholesterol. Well, what do you need cholesterol for? You need cholesterol to make your hormones. So I don't know if you're a girl or a boy, but you need cholesterol in order to make all in both genders. You need cholesterol. You need cholesterol to make vitamin D. You need these things. So for somebody to tell you in their high and mighty ways, man, oh, you don't need this cholesterol, you don't need these LDLs. Well, go look at what it does for you. You need cholesterol and LDL for, transportation of other things that need to be delivered in your body. And so what you're doing is you're lowering them, and so you don't have as much transport. You also don't have a very good immune system. You don't have a very good patchwork. If you got potholes somewhere, that's where LDL comes in. There's a lot of things that we need lipoproteins for, and we're doing ourselves a disservice, and it's really very sad because we are not only glucose centric, but now we're LDL centric, and we're going to change gears here. First, it was cholesterol. Cholesterol is the problem. If you have high cholesterol, you're going to die of a heart attack or a stroke, because the minute you eat saturated fat and cholesterol, it's going to clog your arteries and there's just death. Well, they bamboozled us for a while with that one. Okay. I mean, that is really buffoonery, because they're assuming that you eat fat and cholesterol, it goes down your tube, and then it automatically goes into your coronary arteries and plugs them up. I mean, that how I got bamboozled by that is beyond me, okay? Because that would negate the whole process of breaking down fat in our body. You wouldn't need a gallbladder with bile. You wouldn't need bile. They'll take your gallbladder out, but the liver makes bile, and bile emulsifies fats. Fat just doesn't go like you're pouring it down the drain, but that was the imagery that they used. So we were bamboozled. That was buffoonery. Then they moved to LDL, and that really is kind of still going on, this LDL thing. So if we lower all LDL, we're not going to have a heart attack, or your chances of having a heart attack are much, much less. That's your BS meter should go up, because now you know that you need to have LDL on board, because you've learned this, and you could bring this to your doctor, of course. But now they're going to switch gears and say, oh God, these people are getting so smart. They're listening to these online doctors, and they're getting too smart for their britches. Okay? We got to change it up. We got to start measuring ApoB. ApoB. That's the new marker. Well, basically measuring ApoB is the same as measuring your LDL. Okay? You're not taking into any consideration the function of said LDL, the size of said LDL, the amount of damage and oxidation of the LDL. That's what I'm saying. If you just simply measure ApoB, ApoB is on every LDL. It is on triglycerides. You are measuring an LDL is a lipoprotein, a low density lipoprotein attached to every LDL, and every triglyceride is an ApoB. It is another protein, okay? So if you're measuring all ApoB, you're measuring all of the LDLs and all of the triglycerides, and then they're telling you if it's over 130, you're going to have a heart attack. Not true. But you guys are smart. You're starting to figure out that you don't want small, dense LDLs. You really don't even want all of those triglycerides. And the way to lower triglycerides is to eat a low-carb diet. The way to raise big, giant LDLs that are helpful for your body and lower the small, dense LDLs that are really, really bad because they are oxidized, meaning they are damaged. You do not want a damaged, small, dense LDL, because a small, dense LDL gets damaged by glycation, by carbohydrates. If you are on a high carbohydrate diet, all right, if you're on a high carbohydrate diet, you are going to have a lot of small, dense LDLs. They get oxidized, they get eaten by macrophages, kind of like Pac-Man, and they become foam cells. Have we seen foam cells in plaquing? We sure have. Was that the LDL's fault? So you're just going to lower all of them in order to get rid of all of them? Or are you just simply not going to eat the carbohydrates that increase the risk of having small, dense LDLs? Exactly. It's exactly right, Jimmy. I agree. MJ says, do you do virtual visits? I do. If you want to sign up, you can email me at IronLadyDoc@AOL.com. So as we are talking about moving a goalpost, ApoB is starting to get a little bit, a bad name. because now they're going, man, these people are so smart. What are we going to do now? We got to keep them on this thing where they believe that their cholesterol is the problem of their heart disease. How are we going to do it? How are we going to do it? We're going to measure LP little a. LP little a. What is LP little a? Lipoprotein A. So now you're going to measure all of the LDLs with the ApoA protein, not ApoB, but it's got an A protein around the lipoprotein. It's smaller, he's more dense, and we're going to say you only need to check it once because it's hereditary. It's hereditary, and we only need to check it one time. There's no way to lower LP little a unless, of course, you take our medication that we're coming out with soon. That is the only way. Otherwise, it's hereditarily unchangeable. You can't do anything on your own to bring it down. You only need to check it once. I mean, even if you take my medicine that lowers LP little a, you really don't need to check it. Well, if you take my medicine, you probably should check the LP little a to make sure it's coming down. This hereditary marker that if it's high, you're gonna have a heart attack. You better start your will right now. See, that's what they do. They gaslight you. It's kind of like SGLT2s. Do you know what SGLT2s are? They're a type of diabetes medicine, and they're for controlling blood sugar. But yet, when the patents are about to run out, we're going to give them another indication. And we're going to give an indication for heart disease. Lowering your risk of heart disease, I'm going to give you an SGLT2, whether you have diabetes or not, actually. It's now indicated as heart protective. Guess what? SGLT2s do to your LDL. They raise them. They raise LDL. So, if you take an SGLT2 and it raises LDL, it can still be considered heart protective. But if you eat saturated fat from animals and raise LDL, you're going to have a heart attack or a stroke. I mean, is this... I guess I don't understand. I mean, that should be a Stop and Think Thursday really, because, you know, another thing is your calcium scoring tests. You know what? I'm going to take this one by the hand, and we'll put you in. I don't need... I don't need derogatory comments over there, but thank you, you guys. I appreciate your questions over there. CAC score. What do statins do was a question. What do statins do to your calcium score? Okay. They raise it. And they will tell you why it's okay if the statin raises it. Let me give you their interpretation. If you're on a statin and your CAC score goes up, it's okay because the statin is stabilizing your soft plaque, your soft core, the one that could break off and go downstream and cause a heart attack. So if you take a statin and your CAC scores goes up, it's okay because it's stabilizing the soft plaque into a calcified plaque. So in that case, it's okay. But you've been told that if your CAC score goes up, calcium scoring test goes up, that is a risk for heart disease. I mean, the gaslighting that's going on, the buffoonery that they're trying to bamboozle us with, it's alive and nobody stops and thinks. We need to stop and think, you guys. We're being bamboozled. Dirty Muffler says, how do carbohydrate restricting diets affect sex hormone binding globulin? Okay, let's first define what sex hormone binding globulin is. It is a protein. It binds sex hormones, in this case, testosterone. When we measure testosterone in men, we should measure a total testosterone, a free testosterone. We should measure an estradiol level. We should measure a sex hormone binding globulin. Why? Total testosterone. When you measure total testosterone, it's either free or it's bound. If it is free, it's usable. If it is bound up by sex hormone binding globulin or even albumin, those are proteins that bind testosterone, they are not usable. You don't want zero sex hormone binding globulin, but you don't want too much. If it's too high, then it's going to bind up your testosterone and make it bound and not free. So a doctor who only checks male total testosterone is not doing them any justice, because they'll say, oh, it's 600. You're fine. You're 45 years old and it's 600. That's normal. You're okay. No, doc, truly. I don't feel well. I feel fatigued. I'm starting to get fat. My libido sucks. All of these things. Nope, you're fine. Your total testosterone's over 350. You're fine. Doc, you didn't even get a free testosterone. You didn't even check my sex hormone binding globulin. This is the disservice, because I don't think the doctors, they're in a state of ignorosis. Osis means a condition of ignorance in this case. If they just get a TSH and don't get a free T4, a free T3, a TG, a TPO, and a reverse T3, they're in a state of ignorosis, a condition of ignorance. And they're buffooning you. They're bamboozling you with buffoonery. And you guys never look anything up. Well, you guys do, because you're smart. You're listening to people like me. And so you're getting a hang of this. You're starting to use your brain. It's waking up. So a person who is eating a lot of carbohydrates and gets insulin resistant, their testosterone is going to be bound up more than free. They have little ovaries in their fat. I know that sounds crazy, but an ovary will aromatize testosterone to estrogen. So a male who's get insulin resistant, their aromatase enzyme will be hypervigilant. Their testosterone will be aromatizing to estrogen, and they will continue to get fatter and fatter and fatter, okay? In order to get your testosterone to start working for you, or to even increase the testosterone, you need to eat more saturated fat. If I go through the process of making hormones, girl or boy, it starts out with saturated fat and cholesterol, which makes pregnenolone. Pregnenolone can make some progesterone. Pregnenolone can tell the adrenal glands to start kicking in and making DHEA. DHEA converts to androstenedione. Androstenedione will aromatize to testosterone. Androstenedione can convert to testosterone, and testosterone will aromatize to the estrogens, E1, E2, E3. Okay? You first need to start with fat and cholesterol. If your body is consumed with high carbohydrates, your insulin level will go up. And in men, this causes in the body fat, like around their belly, to act like an ovary. So they will be trying to aromatize their testosterone to estrogen. So their testosterone levels will drop. Estrogen levels will go up. They will get fatter. All because of high insulin. All because of high glucose or fructose, blood sugar. Okay? Now, you don't want a very, very high sex hormone binding level. I think 20 is a great number for men. If it's too low, you might lose your libido. If it's too high, you have no free testosterone. Okay? Cody says, what are my thoughts on HCG peptide and how it should be used in men? You guys, that is a complicated question because what HCG is doing, you have to ask, let's go back. Cody, why is Cody asking this question? Is Cody somebody who is taking hormone replacement, HRT, their natural production of when a man takes exogenous, outside the body testosterone, it's going to shut down their natural production of the Leydig cells in the testicle to produce testosterone. When that occurs, the testicles will shrink down. They go from a jewel to a raisin. And with that being said, those cells in the testicle stop producing their own endogenous testosterone. Your body's relying on the exogenous testosterone. Some people with HRT, hormone replacement therapy, their doctors will give them not only testosterone to supplement their lower testosterone, pump up their own natural production of testosterone from their testicles and maybe get the testicles to start growing again. Okay? I don't know if that answered your question, but hopefully it did. Denver says, I go out of my way to listen to this doctor. She's helping me with diet and general health. So yes, she is a great doctor. Thank you. I appreciate your kind words, Denver. Linda says, how do we get a doctor to order a proper test for testosterone? Ask them. Ask them. And know why you are asking for it. I mean, seriously, should we really have to beg our primary care doctor to check a lab? Why is it that a doctor feels the need to tell you what is okay or not okay to order? What gives the doctor the authority to tell you what you can or cannot ask for? Even in my bamboozled state of mind, if a patient came to me and said, could you order all of these tests? And my first thing I would say, why? And then they'd say, because I want them. And I go, okay, that sounds like a good enough explanation to me, but here's the deal. The things you're asking for, I have no idea what they are. And so, yes, I will order them, but here's the kicker. Because I don't know what they're for, I may not have a diagnosis to get your labs that you're requesting paid for. In order to get so if I order a lipid panel, I'm going to look for a diagnosis of hyperlipidemia or dyslipidemia because I don't really want you to have to pay for the lab. So if you had a little bit of elevated triglyceride, I could put mixed hyperlipidemia as a diagnosis. And then that triggers the insurance company because there's a diagnosis attached to a lab, they'll usually pay for it. If I want to check your full thyroid, I might put fatigue as a diagnosis. I mean, everybody's got a little fatigue, right? I mean, who doesn't have fatigue? But in order to get thyroid paid for, I'll put fatigue. If I want a CBC, I'll put fatigue. I need a diagnosis. But if you're asking for all these tests and there isn't a diagnosis, your insurance company will deny payment to the lab, and then the lab will send you a bill. And if you're okay with that, fine. But don't blame the doctor for not getting it paid for you. I do my best to try to find a diagnosis in order to attach it to the lab you are requesting. Make sense? So if you want a vitamin D level, for the most part, you've already been checked one other time and it was low. You could put low vitamin D as a diagnosis. You could just put low vitamin D as a diagnosis because I guarantee you when you get a vitamin D level, it's going to be low. And so that attachment to the diagnosis now gets paid for with the insurance company. Here's another thing. Because I told the patient I don't know how to interpret those tests that they're asking for, I have them sign a little form that says, it basically gets me off the hook. They're going to say, I want this, and this. I say, I don't know what that is. And would you sign this form that you are releasing me from interpreting the results? You requested the result. You requested the labs. You are going to interpret them on your own. And you've released me, doctor, from having to do that because I don't know what they are. And I will put that in your chart. And they say, fine, where do I sign? That is how you do a shared decision-making with your patients. But if I'm a paternalistic doctor, I am going to tell you from an authoritative process what you need or don't need. I'm going to tell you. I'm Mama Bear and Papa Bear. You want a lipid panel? I say no, I'll get a total cholesterol. You want a thyroid panel? I say no, I'll get you a TSH. That's paternalistic. Find a new doctor. Okay? Do you really want to work with somebody who's slapping you on the hands after you paid $1,000 a month? Here's what could be going on. This is really where it gets dark and evil. Is that doctor might be paid bonuses by keeping spending down. So when you go and ask for all these things, it could be coming out of their pool, especially if they have to send out some of the things and it doesn't get done in-house or in the hospital network. Like maybe you need to send it out to Mayo Clinic. Then they're really going to take a hit. Is it going on? I'm going to be perfectly honest with you. I have been out of corporate medicine for going on 14 years. I've been in private practice for 14 years, coming on 14 years. So can I prove that's still going on? It was at one time. Is it still? I don't know. But these are things to keep in mind. If you say, you know what, I don't want to mess with my doctor. I'm just going to go online and order my labs on my own. I'm going to pay the $500 to get them paid for. Then if you have the money, just get them on your own. If you guys need a list of what I think is pertinent labs, email me. I'll send you a list for free. You don't have to pay. All right? If you say, doctor, can you get the labs done any cheaper? I might be able to. Ask me what you want. I'll send you a cart of labs and you compare prices. If you want to compare prices to ownyourlabs.com or labcorp.com or Dr. J, I'm not getting anything for it by ordering your labs, but if you want to compare prices, I'll send it to you. I'll send you, if you say, oh my gosh, yours are like $100 cheaper from your lab because I get a discount. Now, you could find a discount somewhere else, equal to mine. But if you want me to order your labs, your doctor won't, email me. I'll send you a cart of labs and you just, follow directions and pick a draw station in your zip code and you can get your own labs. If you want me to help you interpret them, I will. If you don't want my help, I won't. If you want to consult with me to go over them, there is a charge for that. Okay? So I will help as best as I can, but there are certain states in the United States that won't accept any doctor online ordering labs. New York, Rhode Island, there's like five states that don't allow people to go outside of their doctor. They're controlling. Okay? Okay, Chaz, I don't know what your question is. And can HCG be a remedy for that? I'm just clicking in now. I found, okay. Oh, Chris, yeah, I don't know. I found out insurance covers minoxidil for hair regrowth. Kind of pissed me off. Found out insurance covers it or doesn't cover it. QQ, I do not know about GHK-Cu peptides. Lopersqua, sorry if I'm butchering that. I asked my MD, I have to have a diagnosis. You have to have a diagnosis for that lab, whatever the lab is, in most cases, in order to get your insurance company to pay. If you don't care about your insurance company paying, then don't worry about it. But many tests that people ask me to order, I have no diagnosis that will cover that particular test, and then it goes over to the patient responsibility to pay for it. So the lab will send you, patient, the bill, okay? Because they're not getting any reimbursement from the insurance company. And you will likely have to sign something called an ABN. It's a form that you basically admit that you will take over the bill if it doesn't get paid for. Linda says, does activated charcoal supplements have any benefit? I do not know. I suppose if you swallowed some poison, they have some benefit. Fifth River Rat, I love your videos. Thank you. I appreciate your kind words. Thank you for your support. Oh, geez. I just dropped you guys. Are you guys okay? I just dropped you. Are you okay? I apologize for that. It was a question on vitamin D. I dropped you and, oh my goodness. What was the question on vitamin D? Help me out. Oh, here it is. I asked my doctor for a vitamin D test. He knows I've been taking from an old doctor, but haven't been tested in years. My insurance company usually pays for all of my tests except for one coronary calcium score. Yep, usually insurance will not pay for a calcium scoring test. So, Mr. Dunham, you just tell them that you have low vitamin D and say, can you put that as my diagnosis? That it's as simple as that. Just put, doctor, I have low vitamin D. Vitamin D deficiency is the diagnosis. I can't remember what code it is. I can't remember. You'd have to look up the ICD-10 code for vitamin D deficiency. And then give them the code and say, can you put this in because I have this diagnosis? ACG says, I worked 38 years as a nurse and you are exactly correct. Thank you for confirming. I don't like to be exactly correct, but I just like to be a little bit on the correct side, and hopefully I'm giving you accurate information. What routine lab do you recommend for female 52 entering menopause? Thank you. I love very brand minded and look at alternatives. You can email me, IronLadyDoc@AOL.com, and I'll send you a list. What is my specialty? It's family practice. Linda says, are labs blood or urine or stool? You can do all of them. You can, whatever you want me to order, I can order blood work. I can order a urine, like a microalbumin. We can check your urine for infection or protein, whatever you would like. Stool samples, if you're having, stool problems and you don't want to go to your doctor and you say, Dr. Jensen, can you order me, ova and parasites, get a culture, do this? Yeah, I can order it for you. And then you can do it all on your own and figure out what you got growing. Talo is needing me today. He's very needy. I wish you could see him. Maybe you can. This is Talo. And by the way, on Instagram, there is a live fundraiser going on for Rescue, Rehab, and Rehome, where I got my Talo. His real name is Norman Talo. He came from Norman, Oklahoma. And yeah, this is Talo. He has been with us for, how long have you been here? How long have you been here, boy? 9 months. He is really learning the ropes in the Jensen household, and he loves carnivore. He loves carnivore. He's my best eater. He can eat meat. He eats till he's comfortably full. He loves eggs and turkey and pork and chicken, and he even eats tuna and sardines, and he loves beef. He loves steak, only if it's cut up in small pieces. Okay, so yes, all right. Do you want down now? We're reading questions here, buddy. Cody says, thank you for the great information. I was thinking more of coming off TRT and the use of HCG to get me stable again. That would be one of TRT, testosterone replacement therapy, or HRT, hormone replacement therapy, whatever you want to call it. Taking HCG could help kickstart your testicles into producing their own testosterone. Because let's just say you didn't take HCG, it could take upwards for a year for your, we'll get down. It could take a year for your testicles, if they're going to come back, depending on how long you've been on TRT or HRT, your testicles may never come back to a sufficient level. HCG might be able to kick it back into gear. May, I don't know. It's a possibility. That would probably be the only time I would suggest that you talk to your doctor about that. What peptides do I use? None. Insurance companies never cover cosmetic drugs. As in what? What is a cosmetic drug that it doesn't pay for? I might be able to help you. Let's see. Good morning, RM. Thank you for joining. We appreciate you. Denver's okay. I know, I dropped you guys. Whew. I'm glad you're okay. Jack says doctors don't like the vitamin D test for some reason. I don't know why. Lucy says, do we need a prescription for a calcium score? Where I'm at, a lot of the outpatient radiology places would like a doctor referral, a doctor prescription. Some of them are getting to the point where, hey, we can make money. Insurance isn't paying for this anyway. I'm going to bypass the doctor prescription. And if a person requests a calcium score and they're paying me $100, I'll let them in. Chaz says, my question was, men who have been on testosterone for a long time and then experiencing achy testicles, is HCG usually the remedy? And are you familiar with this? I have never had any of my patients complain of achy testicles, and so I would talk to a urologist about that. I do not believe if simply taking HCG will help with your achy testicles. I would definitely see your doctor. RM says, for me, my endocrinologist had to order the vitamin D test. Make sure you get an active vitamin D and a stored vitamin D level so you can get a ratio to know if you're in the right range. Okay? Have I heard of the virus Kestia? No. Okay. John says, how do I pay you? You can use credit card, you can use PayPal, you can do super chats, you can do super stickers, you can do it all. Truth Seeker says, docs in our local hospital systems, corporations are contracted to follow protocols that if the intake nurse did not write down a symptom that the doc can attribute via this, okay, then the doc is not allowed to order the test for you. You have to schedule another appointment and then tell the intake nurse the symptoms. Wow. That's pretty deep, isn't it? Truth Seeker, regardless if you are a cash patient or not, yep, they still won't do it. They want total, most, many, some, however you want to look at your doctor, they want control over you. They've gone to school. Listen, Truth Seeker, doctors have gone to school a long time. They deserve your undivided attention and charm. You are there for them. In some, many, most cases of doctors, the fact that they showed their true colors when they said, I'm not ordering that. You don't need it. Now you know who they are. They just unveiled themselves. Do you want a doctor like that? Am I taking on new patients? No, I am not. I am an online consultation service only. If you would like to sign up for a consultation, email me at IronLadyDoc@AOL.com. IRON, Iron, Lady, LADYDOC, doc, at AOL.com. I do not repeat, I do not accept insurance. Tallow, 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 as in beef tallow. He was named after the beef tallow that he so loves to eat. He's he's a handsome boy. I spent 3 hours yesterday. This is off the subject of health. I spent 3 hours yesterday talking to AI, trying to figure out what breed he is. And I got it down to, he might be a Basenji dachshund. And the people who told me when I got him from the rescue, they labeled him as a dachshund mix. And when I saw him, I go, this is a dachshund mix. I mean, I have 2 dachshunds. He's kind of tall. He's got long legs. He is not a shorty pie for sure, but he's got this dachshund head. But I went through the questions to get AI to pick breeds for you. You have to go into the curl of their tail. Is it a tight curl? Is it a loopy curl? Is it a straight curl? Oh yeah. You can go in by the shape of their eyes. If they have squints, like an 11 on their forehead. I mean, there are so many. How their ears drop. Do they drop forward? Do they drop to the side? Do they drop back? All of these things. And AI can help you without doing a DNA test. It took me 3 hours, but I ask a lot of questions. I want to know. So anyway, it picked out a Basenji dachshund. There was even a little, what they thought could be a mountain cur or a tree cur, C-U-R in him. But overall, they came with a Basenji cur or Basenji dachshund. So I had to go look at what a Basenji is. And I go, oh, he might have a little bit of that. But I guess when you mix it with a dachshund, you get a, whatever that's called, a Basenji hound. a dachshund, a dachshund, a Basenji hund. Okay, that was my yesterday. It wasn't wasting time. I was actually doing something. Okay. Correct. This is not medical advice. It's for information purposes only. And speaking of coming off of TRT, wouldn't you want to use HCG and FSH and LH? Chaz, I'm not sure what your question is there. Are you using the HCG for the FSH and the LH? Is that your question? The HCG will help with your testicle, the Leydig cells. RM says, what age should women start taking collagen supplements? Why are you taking collagen supplements and why is it age? Why not just eat beef or meat, salt, and water and with a 1-to-1 ratio of fat and allow your own body to consume a natural source of collagen instead of taking a supplement, which might be just some white powder in a container. Again, it's been processed. Eat the real thing. What age should women start eating collagen? The minute they can start chewing some beef, some steak. Their moms probably could start gnawing it and give it to the baby. That's how things used to be back in the day before formula. They would breastfeed, but if you couldn't breastfeed, that baby started eating whatever the mama was eating. If mama was eating some deer, baby was eating deer or bison or buffalo or sheep or lamb. Whatever it was that the mama was eating, Mama Bear was feeding that to her kid. He can't chew yet, she chewed it for him. Minoxidil is a cosmetic drug. I am sure, Jack, that you could get a diagnosis out of that alopecia, mixed with some other diagnoses. Lady of Iron. Yeah. I lift weights. Daryl Brown asks, would you recommend clonazepam for anxiety disorders in individuals with Asperger's? I think you need to see your personal doctor for that question. I don't know what this question is. Daily cardio for default energy levels. Put it into a question format and I might be able to help you. Alopecia is not natural, guys. It is not natural. Are your lives able to be reviewed on YouTube? Yes, they are. Just go to my channel, Iron Lady Doc, Center Stage Primary Care. That's me, Center Stage Primary Care, Center Stage Primary Care, Iron Lady Doc, Malea Jensen, and you can look up all of my videos, all of my shorts, all of my live streams, all of them, just like you can anybody else. Where am I from? I am from Iowa in the United States. Jack says, my primary care doctor is useless, spends 5 minutes with me, and fights me on every test I ask for. Find a new doctor. What do you think about weight loss medication? Why don't you ask me a question, a more specific question? I might be able to help you. Thank you, RM. That's perfectly stated. I appreciate that. Beef is prohibited in your religion, in our religion. So what about deer? What about bison, buffalo, sheep, lamb? What is the best weight loss product for someone that had a hysterectomy years ago? Well, if you had a hysterectomy, it should not affect your hormones at all. If you had a total hysterectomy where they removed your uterus, that's hysterectomy. For you guys that say ectomy means removal of the hyster, Hyster is the uterus. So it's a uterusectomy, a uterus removal years ago. That tells me nothing about the ovaries. Now, if you say I had a total hysterectomy and oophorectomy and fallopian tube removal, total hysterectomy, then I would say your estrogen levels could plummet. If you want a natural way of raising your estrogen levels because you've had your ovaries removed or you're in menopause, postmenopause, then I would consider no or low carb diet with high saturated animal fats and moderate amounts of animal proteins, and your natural production will come back. Getting off of synthetic estrogen patches in your best interest. Just my opinion. Do I recommend any supplements after 50? The only reason you will need a supplement is because your diet is poor and you need supplements because your diet leaves you malnourished. You're gone. Thank you. Would 20 minutes of cardio most days make me less likely to not want to do anything? Would 20 minutes of cardio make me less likely? Lot of negatives and double negatives in there. I don't know what your question is. Yes, any meat and gristle is collagen. That is what collagen is from any animal. Shane says, suggestions for anxiety without medications. Find out the cause of your anxiety, Shane. Carrie, I think you should talk to your doctor in regards to that question. Thanks for asking. Truth Seeker says, to help your channel grow, you may want to consider some merch with your YouTube channel name and shirts, hats, sweaters. Do you know something, Truth Seeker? I actually just signed up for the super chats and super stickers because we're getting a lot more people asking questions and we're not getting to all of them. And so the option, people were messaging me asking me to set up the super chats. So I said, okay, because they want their questions answered and they're willing to pay for that. I appreciate that. And so this morning I was talking to one of my friends and asking if they would help me set up my store, which I already know how to do, but I'm going to set up the store, but helping me with cool logos or cool prints on gear, put your logo or whatever we will, and then I'll start the YouTube channel or connect it to the YouTube channel. YouTube has certain stores that it likes to use. Let's see, Fourthwell, Shopline, Shopify, Spreadshop, Spring, TeePublic, Wix. So I was actually looking into this morning. So Truth Seeker, that will be the next up and coming thing. I do have an Amazon store at it is at Center Stage Primary Care, Dr. Malea Jensen. Good morning, doctor. What diet lower blood pressure? A low carb diet, one that lowers insulin. William says, I need help with organic chemistry. Take a class. Okay, Lucy, my moderator, is going to check out, but I still have Linda and I still have RM available for, they're the blue wrenches. I have an idea for a logo. I have a recommendation for a really great graphic logo designer. Well, it's going to have to be inexpensive at this point in time. So many of you have sent me actual logos free of charge because you just feel that it is your way of giving back, and I appreciate that. Jack, I don't know, you're asking about a calcium score of 380. I would talk to your cardiologist if you would like to give me more information. If you're super fit, I don't know what the definition of super fit is, but if you would like to do a consultation, email me at ironladydoc@aol.com. All right, you guys. We're going to call it quits today. It's Saturday Live with Dr. J, and we are going to be back tomorrow, Sunday at 10 a.m. Central. And yeah, this is going to be an awesome thing. We're just getting going with the YouTubers, trying to keep them in line. You Instagrammers, thanks for bearing with me. Love purses. If you can be back tomorrow, I am sorry I missed your question over here. Melanie, you're very welcome. But I can get that answer to you tomorrow, or tomorrow, 10 a.m. Lord willing, I will be back. So you guys have a blessed Saturday, and we'll see ya.